Hello, I'm Alex Whitfield, Chief Executive of Hampshire Hospitals, and it's my privilege to share with you our review of 2023-24. For all of us here at Hampshire Hospitals, 23-24 was a year that saw many achievements and successes, alongside a number of challenges. As always, we have worked together in our shared ambition to provide outstanding care for every patient who's needed our services. Our people and patients are at the heart of everything we do, and I'm so proud of our colleagues who work with dedication to deliver safe, compassionate, high-quality care. Our I-Care values guide our behaviours and decisions. Every day we see fantastic examples of colleagues delivering inclusive, respectful, compassionate care with absolute professionalism. Throughout 23-24, we have progressed our 5 strategic priorities: providing outstanding care for every patient, making our trust a great place to work for our people, working together for our population, making the best use of our resources, and innovating for a sustainable future. As part of this, we've had a real focus on reducing waiting times for both planned surgery and for emergency care, and on making sure people can return home to their loved ones as soon as they are able. Despite the pressures and challenges of the year, we have continued to prioritise providing the right care in the right place at the right time, meeting the individual needs of patients and making sure our care is safe. We're proud of our work around valuing patient time, focusing on what can be done to keep patients well whilst they're in our hospitals, and reducing unnecessary delays to their hospital stay.
Patient flow is very important because if patients don't move through the system effectively, then it means that patients are unable to come into the system.
We know that there's a mismatch in capacity and demand for our acute and emergency services. We know that we struggle to get patients out of hospital to be cared for in the right place, and those things combined mean that sometimes we're unable to move patients through the system in the way that it's designed.
So what we have done is we do 3 times day safety huddles where we discuss who's here and who needs to not be here and what we need to do to get them out and moving. My night team, they have put a process in place where they do their SATs. Anybody who's going to need some additional care leaving the building, they prep everything overnight. So in the mornings when we get the go-ahead, we tick the button and off it goes. And for that, we've really managed to get ahead of a lot of other areas. And getting SATs done in a really timely manner is fantastic for getting patients through the system and home quicker.
There are numerous stories of teams providing safe, effective and personalised care to help people return home and avoiding hospital admission.
My name's Fergus and I'm currently a patient at HSFT, but more now as an outpatient rather than inpatient. I have a genetic condition, osteoarthritis, which actually know now started in my 20s. So my relationship here has been brilliant because they've been going through each test, scan, x-ray to discount a whole range of issues, and that is what good medical and clinical care is, and get us to a position where we are today, and which is very recent, about what's the way forward. But a long-term condition means you interact with, it could be surgical, it could be physiotherapy, it could be your radiotherapy, it could be scans, inpatient, outpatient. It's really, so you have this global view about what works and what isn't working very well in the system. I've got a kind of net of support around me. The quality of the medical care, the empathy, the professionalism of my journey, and I'm still along that journey, and an LTC is a non-stop journey, has left me, when I talk about net of care, an extraordinary reassurance that finally I've been listened to. The overall sense of how do staff in NHS do this, whatever this is, and to do this right now in terms of what's happening. And I don't know how to thank you.
In line with our clinical strategy, we have continued to co-design our services with our patients, carers and public, listening to what matters to them most and using our quality improvement methodology to improve our services.
Hampshire Hospitals has been through a real journey when it comes to working with patients and the people who use our services. There's been pockets of great work, for a long time. There's some really great examples. But what has happened over the last few months and the last year is there's been a lot more centralised approach to the way that we involve people. The people who are using our services are the ones that are really experiencing it and are really the experts in that and the experts in the context. As professionals, we really understand the processes. We have real expertise in what happens and the bigger picture, but without working alongside our patients who are receiving that service and experience it, we don't know really what's working and what's not. We've been working closely with the QI team to develop a co-production in QI Masterclass. This has been a true example of co-production in practice. We started from essentially a blank piece of paper and we've been working in partnership with a group of patients to design a full-day training session.
This group is very much wanting to hear how we experience the organisation, the processes within that organisation, the departments. So they very much invite us to be involved in any little projects, even if it's just an idea. Tell us what you think. So this session, we've very much been part of creating a quality improvement co-production workshop. Actually, real patients, real caregivers will be helping to deliver that session, talking to staff, encouraging them to come and work with us.
We've worked hard on improving our maternity services, and in December 2023, we met the criteria for exiting the Maternity Safety Support Programme. We are proud of our recruitment programme for midwifery, with our maternity units safely staffed and a full suite of policies and procedures in place governing the management of equipment, communication and training. Safe and high quality care is incredibly important, and we are continuing to work with families using our services to develop this care even further. As part of our commitment to providing outstanding care for every patient, we've transformed facilities and looked at how we can deliver services in a different way, including through centralisation. In December 2023, we officially opened our new state-of-the-art cardiac facility at our Basingstoke site, the Hampshire Hospitals Heart Centre. It features 2 cardiac catheterisation labs, offering a purpose-built environment for our specialist teams of staff to undertake diagnostic assessment and cardiac procedures. In the first year of opening, staff within our heart centre treated more than 2,700 patients, including over 200 emergency procedures.
It's just like walking into a Star Wars set. I thought, what, who, what, where, I was mesmerised. I ain't got words for it, to be honest. No, I haven't. I just didn't know what I was going into. When I saw it all, wow. And when you're up on the machine led there, you're looking at yourself inside, you think, that ain't me,
The people who work at the heart of Hampshire Hospitals are our strongest asset. A highly motivated and engaged workforce has a positive impact on patient care and outcomes. A key priority for us has continued to be making our trust a great place to work for all our people. We continue to develop a strong values-based culture that places people at the heart of all we do, where everyone belongs and where learning, improvement and excellence thrive. Our 2023 NHS staff survey results provided us with valuable insight into people's experiences of working at Hampshire Hospitals. This year, we improved or matched scores in 8 of the 9 theme areas, with compassion and inclusivity the highest scoring theme. However, the results told us that there is still more to do. We have seen lower results in some areas compared to last year, and in particular on questions relating to the "we each have a voice that counts" theme. It is vital that all colleagues feel safe and confident to speak up and express their concerns, knowing that we will take the time to really listen, understand, and take appropriate action. The well-being of our staff is an area we've continued to develop and prioritise, and this year we have developed dedicated financial well-being support, menopause tools and adjustments, and mental health assistance, as well as significant investment, thanks to charity funds, in improved rest and break areas, both indoor and out, to enable better rest and recuperation for staff working on our sites. The diversity of our workforce is something we are proud to celebrate. We strive to create an inclusive culture where everyone counts. To amplify and hear the voices of our workforce, it is vital that we provide inclusive and effective channels of communication and learning. We take pride in our staff networks, which support our colleagues, ensuring everyone feels empowered to contribute to the way we run our hospitals and deliver services. During the year, we launched the Neurodivergent Staff and Patients Network.
It started off by an ambition to create a place for people to talk about neurodiversity, a safe place. And like I say, if you think about, we've got over 8,000 staff in the trust, and if 1 in 7 is in the neurodiversity umbrella, where and when and how can they safely talk about this? I think first of all was to give that safe environment for the staff to talk about it, but also because we know that our patients and their carers, family or loved ones, is writing to us or telling us that we don't get it right all of the time.
The Neurodivergent network offers us the ability to be able to share things at a wider level with people that either live with neurodiversity or allies and want to understand more, and how they can change practice or support people that live with neurodiversity. So I suppose the ultimate aim is that we kind of celebrate the staff that we do have that live with neurodiversity, and it's not a taboo, and people feel comfortable to declare the neurodiversity so we can support them in the best possible ways, and make sure that we can support them to achieve what they want to achieve. And from a patient care perspective, I think that understanding what their needs are and meeting their needs and improving care and living to those like eye care values, but to make sure that they leave hospital in a far better position than they came to us in.
I think for me the most important criteria to remember when you talk about neurodiversity is it's not something that's broken, it's not something that needs to be fixed, it's not something that needs to be cured, it's just different.
Recognising and rewarding colleagues for the work they do is important to us, and we've done this over a number of ways this year. In March, we held our first People Awards ceremony to celebrate and recognise the incredible contributions of our staff and the difference they make. We were delighted to see nearly 400 colleagues nominated by patients, families and other staff members. In June, we celebrated Culture Week and continued to develop our cultural ambition statement. In October, we held our Staff Focus Week to show appreciation to our staff through distributing over 12,000 gifts and goodies, as well as hosting a number of fun activities. We are committed to recruiting the right people with the right skills doing the right job, retaining and developing people to work in satisfying and fulfilling roles. Throughout the past year, we've successfully welcomed new international nurses, including trained nurses from Nepal, as part of a pilot initiative between the Government of Nepal and the Government of the United Kingdom.
Hello, my name is Alpana Adhikari. I belong to a developing country, Nepal. I have recently come to the UK 5 months ago in February 26. In my ward, respiratory E3 ward, staffs are very cooperative there. The main thing is they are always very keen to help us, and they are never irritated however how much questions we raise to them. So that has made me a lot easier to settle in my ward. I have learned many things in my ward because of maybe because of our matron, maybe because of our senior staffs there. They are very keen to teach me the things very fast. So technique and skills that we have been learned about nursing. In our country is totally different here, because though the base is same in all the world, but the technique we used in our country is different than the technique being used here. Even the equipments that has been used in our country is different here, so that has been a trouble for me as well, but I'm slowly being used to it, because I have good colleagues in my ward.
During the year, 260 colleagues have been developing through 46 different clinical and non-clinical apprenticeship programmes. 91 apprentices have successfully achieved their apprenticeship this year, including 28 new nurse registrations.
I sort of got into this role as I left college and I wasn't really sure what to do. But I knew I wanted to work in healthcare somewhere, so I was looking online, and that's when I found the apprenticeship healthcare support worker role. So I applied for that, and luckily got that, and it was sort of like the first stepping stone as in my career. In a standard day of mine, I mean, it's good because where I work in the outpatient department, I obviously work closely with a lot of doctors and consultants, and which are all made aware that I am on the apprenticeship scheme, which is really useful because they're really informative, and actually because they know that you're learning as well. Say I'm in helping with them with a patient, they'll go through and explain exactly what they're doing, procedures that they're doing. When I assist, they explain what they're looking for and looking at. So kind of teaching me as well because they know I'm learning as well. So they're really, really helpful and supportive. When I started here, I didn't really know what I wanted to do, but actually being on the apprenticeship scheme and learning all the different things that I have has actually really inspired me to want to do my nursing as well. So that's how, yeah, and then I can do my nursing hopefully and become a nurse one day.
Together with our partners, we've progressed some important projects and programmes that no one organisation could do alone. Across Mid and North Hampshire Integrated Care Partnership, we've continued our focus on supporting patients at home.
Call Before Convey is a system whereby paramedics with patients at home have the opportunity to call into our hospital and have a multidisciplinary discussion with the specialties who work here about where is best to care for a patient. Also, community providers are involved, so we can see if we can find the best urgent care pathways for patients, and that may not be coming to the emergency department. For example, we had a patient who sadly had lung cancer and had reaccumulating fluid around the lung, and that patient would usually come to hospital in the ambulance, be admitted to the medical team and then have a respiratory review once in the hospital. Through this process, the ambulance team were able to speak to the respiratory clinician in the hospital, and we were able to book that patient in for a clinic the next day to have the fluid drained, rather than coming into hospital overnight to wait for that. And it was a great outcome, not only for the patient, most importantly, but also in terms of other system resource in the hospital. The exciting thing about Call Before Convey is that it's a collaboration between Hampshire Hospitals, Southern Health and South Central Ambulance Service. So we really enjoyed working together to get the best benefits for our patients across the system.
We further strengthened our partnership with the University of Winchester. We've continued to work together in a unique partnership to pursue charitable health training, education and research in hospitals in low to middle income countries as part of our collaborative global health hub. This brings together academics and clinicians to facilitate both new projects to grow and existing projects to flourish. Alongside the rest of the NHS, we continue to face substantial financial challenges. It has continued to be important that we spend our money wisely and with best value. Some of the programmes implemented have included delivering services in a different way, often looking at productivity, some centred around increasing income into the trust, and some focused on innovation and transformation. We have increased our day case rate, meaning that we can do more surgery for more patients, not limited by overnight bed stays. This year we began opening services at our new Andover Community Diagnostic Centre. These new and expanded facilities are being created from an £8 million investment to expand community diagnostic services, providing state-of-the-art equipment, a modernised hospital, and reducing the need for local people to travel to Basingstoke or Winchester hospitals for care. In March 2024, plans for our new elective hub at our Winchester site passed their final approval stage, enabling works to begin.
So this is a new facility that's funded by NHS England, and it's an ICB collaborative, providing more elective capacity for our orthopaedic services in Hampshire. And essentially what it is a 2-theatre facility with a ward, providing a new way of doing things with our primary joint replacements. This is hips and knees, for which we've had a massive waiting list since COVID, and we've been struggling to recover from the backlog. And what we're hoping to do is to provide ring-fence facilities where we can guarantee that we can get patients through and improve our waiting lists, but also do this in a new way using up-to-date techniques and really provide the best possible care for our patients. Personally, I really wanted to get involved in this because I've been working all my career in theatres that have been up and running for decades, and this is a great opportunity to be involved in the project where we are designing the theatres and the whole facilities ourselves. We can completely rethink the way we're doing things, patient flow. It's really exciting being part of a project where we have a say in how things are going to work. So if all goes according to plan, we should have the orthopaedic hub opening in June of next year, of 25, and we're hoping that the outpatient facility will be opening in October of next year.
Our work to reduce our environmental impact picked up pace during the year. A key priority for us is embedding sustainability across the Trust. To help with this, during 23-24, we published our sustainability and net zero policy and ran our first Green Team competition with the Centre for Sustainable Healthcare. The projects submitted from across the Trust demonstrated a combined carbon saving of just over 252,000 kilograms of carbon dioxide and projected financial savings of over £400,000 per year, as well as benefits to patient care, patient flow and staff experience. We were delighted that 3 of our teams won awards in the National 2023 NHS Sustainability Partnership Awards for their sustainability-related projects. There's been significant progress made in digital. We pride ourselves in being an organisation that actively seeks opportunities for growth and adaptation. I'm delighted that this year we joined the Radiology Consortium, which means clinicians at Hampshire Hospitals can now view scans taken in Portsmouth, the Isle of Wight, Southampton and Salisbury, and vice versa. This significantly improves patient care for patients that receive treatment in different hospitals, and it is more efficient, reducing duplication and wasted visits. We were thrilled to reach an important milestone in our work with partners to improve hospitals and healthcare services under our Hampshire Together programme, as we went out to consultation with the public. Over the 14 weeks of consultation, we spoke with people from the communities we serve, patients and staff about the proposals. This was an exciting and positive step in our journey to improving hospitals and the quality and sustainability of hospital services for the future. There is so much more I could have told you about, and please do look at our annual report, which has more detail and more examples of the great work my colleagues at Hampshire Hospitals are driving forward. As we look to the future, we can assure you that we will continue working together with colleagues, volunteers, patients and partners for the benefit of our communities. Thank you.